Section 5 Assessment. Lack of assessment and feedback based on observation of performance in the workplace is one of the most serious deficiencies in current medical education practice. John Norsini and Vanessa Birch, 2007. The assessing of the learner is arguably the most important task for the teacher. Students can walk away from bad teaching, but they cannot avoid bad assessment. An understanding of basic concepts and approaches will help you to do a better job. Written questions have a role to play alongside other assessment methods. An assessment of students' clinical competence is key to an assessment of their ability to practice medicine. Portfolio assessment is a response to changes in medical education, including the emphasis on professionalism and the need to give students more responsibility for their own learning. A range of assessment tools and approaches are available to assist with key selection decisions. Curriculum evaluation is an essential part of the educational process. Chapter 36 Questions to ask about assessment. An understanding of the basic concepts and approaches to assessment will help you to do a good job. The importance of assessment. The assessment of a student's or trainee's learning is important for them, for the teacher, the course organizer, the accrediting body, and the public. Important decisions are taken about students as a result of the scores they achieve in examinations. Teachers and the other stakeholders need to know if students have achieved the appropriate level of mastery to move on to the next part of their training program, and if, on completion of their training, they are competent to practice as a doctor. Students need to get feedback on their progress. Assessment is important, but it is one of the most difficult areas in which to get agreement. What constitutes a fair examination and what are the criteria for passing a student? Is the examination assessing what we want to measure? Assessment procedures have been criticized by students, by professional bodies, and by those outside medicine. In a recent court case, a judge criticized a nursing school for a failure to identify in its assessment procedures a nurse who proved grossly incompetent and demonstrated unprofessional behavior after she qualified. For the student, sometimes assessment may be seen as analogous to playing in a cricket match where the rules have not been clearly specified in advance and are constantly being changed by the umpire. Students may perceive meeting the examiner as confrontational and threatening, and view the examiner as someone whose aim is to catch them out and find fault with them. Where there are problems with assessment, this is serious. Students can walk away from bad teaching, but they are unable to do so with assessment if they are to achieve the qualification they seek. The fact that assessment is a key and integral part of curriculum development is often not recognized. Assessment should be inextricably linked to the learning outcomes and teaching methods and seen not only as a testing or measurement problem. Course design and assessment are inseparable. Figure 30.1 Students may perceive the examiner as threatening. Figure 30.2 Students may perceive the examiner as someone whose aim is to catch them out. When thinking about assessment, it is useful to consider 6 questions. The answers to the questions will determine whether the arrangements made to assess the student's competence meet the standards expected. 1. Why assess the student? 2. Who should assess the student? 3. What should be assessed? 4. How should the student be assessed? 5. When should the student be assessed? 6. Where should the student be assessed? Why assess the student? At an early stage in planning an assessment program, it is important to consider the purpose of the assessment. An assessment designed to certify a student's competence to practice as a trainee doctor will be different from the assessment method used to review a student's progress and provide feedback during coursework. Traditionally, assessment has been described as either formative, where the main aim is to provide the learners with feedback about their progress, or summative, where the aim is to determine whether the learners have achieved the course objectives. This distinction has become blurred with the recognition that summative assessment can also be used to provide feedback to the learner, and summative decisions may be based on evidence collected during the training program. The purposes that can be served by assessment include deciding whether the learner is fit for purpose. Has the learner satisfactorily completed the training program and achieved the standard expected by the public and professional bodies to practice as a trainee or as a specialist in a particular field of medicine? Assessment has a key role to play in mastery learning and whether the learner is fit for purpose. Basic principles of mastery learning are that the required standards will be achieved by all learners and that little or no variation in measured outcomes will result. This has implications for assessment. In an assessmento, a standard or competency-based approach, what matters are the standards students achieve rather than the time it takes to do so. Assessing the student's progress during the education or training program. A student's deficiencies should be identified early in a training program so they can be remedied. Waiting until a final examination at the end of training will be too late to take the necessary action. This is particularly true with regard to the assessment of behavior and attitudes. Grading or ranking the student with the aim of identifying the best students among those being assessed. This non-referenced approach to assessment is applicable when candidates have to be selected for a limited number of posts, or students selected for admission to medicine where only a set number of places are available. This approach to assessment should not be confused with a criterion referenced approach where the learner's achievement is assessed against the expected learning outcomes or a set of criteria and not as a comparison with how other students perform. Enhancing the student's learning. Assessment can benefit learning in a number of ways. Emphasis is now placed on assessment for learning as well as assessment of learning. In addition to serving as a tool for accountability, assessment can be a tool to support and improve learning. In what is known as test-enhanced learning, the act of taking a test and retrieving information from memory can directly increase retention of information. Testing can also help a student to assess what they know and provide feedback for further learning. Motivating the student. It has been demonstrated that assessment has a powerful impact on students and is a major factor in driving their learning. In Dundee Medical School, we found that students paid less attention to the discipline of otolaryngology because there was no examination on the subject, despite the topic being taught in an imaginative problem-based way. When the subject was routinely included as a station in the final objective structured clinical examination, the students' approach to studying the topic changed dramatically. Providing feedback for the teacher. The teacher can glean useful information from student assessment, but all too often this source of information is untapped. The analysis of students' scores in one multiple choice question examination revealed that students had performed badly in a question relating to diabetes. This was subsequently found to be related to a weakness in the training program which had to be addressed. Bringing about assessment-led innovation. Recognizing the powerful impact assessment has on the student and the teacher. Changes to assessment can be used to lead changes in the curriculum rather than assessment coming at the end of the curriculum planning process. Who should assess the student? One reason why assessment is complex and the teacher's responsibilities may be unclear is that there is a range of stakeholders involved. These include international accrediting bodies, national accrediting bodies such as the General Medical Council in the UK and the National Board of Medical Examiners in the United States, professional bodies, for example the Royal Colleges in the UK and the national boards in the United States, other healthcare professionals, the public and patients, the individual school where the student is enrolled, the department or course committee responsible for teaching the subject, the individual teacher, the students themselves. In medical schools in the UK, student assessment has been the responsibility of each medical school, with the assessment process overseen by the General Medical Council. Teachers from other schools serve as external examiners and along with internal examiners participate in the development of the school's examinations, their implementations and pass-fail decisions. In contrast, in North America and in some other countries, there is a national examination that students are required to pass. Each approach has merits. A national examination, while setting national standards, may stifle innovation in individual medical schools, and there is no evidence that doctors are safer and make fewer errors in countries with a national examination. After completing their training, doctors have to take responsibility for assessing their own performance and keeping themselves up to date. Not all doctors have the necessary skills or recognize the importance of this responsibility. Students must be given experience in assessing their own competence as part of their undergraduate education with reinforcement throughout their postgraduate training. Problems with unreliability in self-assessment are well recognized. There may also be problems with how students react to the assessment of their own competence. On one occasion, we asked students to mark their own examination paper against a model answer. Some found the procedure so traumatic that they were unable to complete the process, and to our surprise required counseling as a result. Training students to become doctors who are inquirers into their own competence and who are comfortable with this should be a required learning outcome of the curriculum. Increasing attention is being paid to peer assessment, the evaluation of students by their peers against certain learning outcomes has become part of some institutions' assessment strategy. This is particularly valuable in the assessment of attitudes, where often the student body has a better understanding of an individual student's strengths and weaknesses than the teachers. What should be assessed? A key feature of outcome-based education, as discussed in Section 2, is that assessment is matched closely with the specified learning outcomes. This should be set out in a blueprint that maps each assessment to the expected learning outcomes. What we choose to assess in the education program demonstrates to students what, as teachers, we value. Many problems encountered with assessment arise from a failure to adequately consider what is assessed. Assessment drives learning as we have described above. What is assessed becomes, for students, the course objectives. In the past, the emphasis in assessment was on the knowledge domain with less attention paid to skills and attitudes. There were a number of reasons for this. Mastery of knowledge was traditionally regarded as of greater importance than the development of attitudes. Knowledge was also easier to assess than other domains, so there was a natural tendency to assess what was easy and to shy away from areas where assessment was contentious or difficult. Written assessments, including multiple choice question papers that tested the knowledge domain, dominated assessment practice. Someone who can answer correctly a set of MCQs, however, is not necessarily a good doctor. There has been a move to assess the student or doctor's more complex achievements, such as higher order thinking, critical skills, attitudes, and professionalism. The introduction of the OSCE stimulated the assessment of psychomotor and other performance-related skills. More recently, the adoption of portfolio assessment and multi-source feedback recognized the importance of the assessment of independent learning and self-assessment skills, attitudes, and professionalism. With the many changes advocated in medical education and the different expectations we have of our students in today's curriculum, it is important that assessment does not lag behind. What we assess must closely match what we expect students to learn. Competency-based assessment. The move to outcome or competency-based education as described in Section 2 necessitates by definition a robust approach to assessment. Doctors will be certified on an assessment of the attained competencies rather than time in training. The assessment tools selected need to be able to assess the student or trainee's mastery of the wide range of specified learning outcomes. In competency-based education, assessment should be embedded in the education or training program. There should be a greater emphasis on formative assessment, and this should be part of the culture of the program. Tools will be further developed to better assess on-job competencies such as interprofessional and teamwork skills in the context of the complexity of medical practice. How should the student be assessed? A wide range of tools or instruments are now available that can be used to assess the student's competence. Some of these are described in the chapters that follow. Just as important is the way in which the tool is employed. A good tool badly used will yield inappropriate or misleading results. We now have a better understanding of what makes a good assessment. The method should be reliable and consistent. This relates to the certainty with which a decision can be made about the student's performance on the basis of the test results. For a reliable assessment, the measurement instrument must be relatively stable. It would not be good practice, for example, to use an elastic tape measure to measure lengths. The measurement would not be reliable. High reliability was one of the reasons for the adoption and widespread use of MCQs. Problems with reliability associated with traditional tests of clinical competence were highlighted when we found that examiners watching the same clinical performance awarded different scores to the examinees. Watching a video of the student's performance some weeks later, they were not consistent with the marks they had awarded. The problem of reliability was a factor that stimulated us to develop the OSCE. Figure 30.3, a range of assessment tools are available. The method should be valid. In other words, the assessment method should measure the learning outcomes intended. The test should be an honest one, testing what it purports to measure. An essential element of an authentic curriculum, as described in Chapter 12, should be authentic assessment. There may be a trade-off at times between reliability and validity. This is illustrated in the classic story of the drunk man who was seen at night looking under a streetlight for his car keys which he had dropped. When asked why he was looking there when he had dropped them a short distance away, he replied that it was easier to see what was on the ground under the light. His search strategy, although having some merit, was not valid in his situation. Measurement of an athlete's performance in a high jump is not a valid measure of how the same athlete will perform in a long jump. Figure 30.4 tests should be valid as well as reliable. Valid, reliable. Unfortunately, in the past, reliability has been emphasized at the expense of validity. What is needed is a test that is both valid and reliable. A test may be reliable, but it is of no value if it does not measure what we want to measure. Unfortunately, the more simple a test, the more likely it is to be reliable, while at the same time the less likely it is to be valid. Medicine, by its nature, is a complex subject, and assessment of professionalism or communication skills is by necessity complex if it is to be valid. The method should be feasible in terms of the resources available and the number of students to be examined. The assessment scheme should not be overly complex and should be capable of being implemented in routine practice. The assessment should have a positive impact on the student's learning. When we first introduced the OSCE in the final examination, we found that students spent less time in the library revising their theoretical knowledge and more time learning on the wards. This was in line with the aims of the curriculum. Vander Luton and Schuworth have described the utility or value of an assessment as a function of these features. Utility equals reliability times validity times feasibility times education impact times cost effectiveness. Standard setting. It is helpful to think of assessment in two stages: the collection of information about the student's competence, e.g., at stations in an OSCE, in a portfolio, or in a written examination, and a decision as to whether the student has achieved the standard expected. There should be a decoupling of the assessment moment and the decision moment. A standard is a statement of whether a student's examination performance is good enough for a particular purpose. A standard setting strategy should be adopted which serves as a basis for deciding whether a student has reached the standard required to pass the examination. Relative or non-reference standards are based on a comparison of a learner's performance with his or her peers. For example, 75% of learners will pass. Absolute standards, in contrast, are based on the learner's performance in terms of set criteria. For example, 60% of the MCQs answered will be correct. Much attention has been focused in recent years on methods of determining the standard expected of students in an examination. Should the pass mark be 60% or should it be 55% or 65% of questions answered correctly? A range of standard setting methods to determine the passing score for an examination has been employed for written and performance tests. These are based on the involvement of and discussions by a group of subject matter experts. Setting pass standards is a complex task and beyond the scope of this book. Useful introductions to setting standards in examinations can be found in the references provided at the end of this chapter. Programmatic assessment. Given that every individual assessment has severe limitations with regard to the decisions that can be based on the results, Vander Luton and Schuworth proposed that assessment of the student should be undertaken at the level of the program rather than the individual examination. Information is gathered from individual assessments, seen as individual data points, but decisions are made only when sufficient information from individual data points and assessments is combined. Decisions are made in relation to the expected learning outcomes, e.g., communication skills or attitudes based on information obtained from multiple sources, including in the case of communication skills and OSCE, mini-CEX, and multiple source feedback. Information can be collected in a portfolio. Pass-fail decisions are not made on individual data points, but these are used to provide the student or trainee with feedback. When should the student be assessed? Traditionally, learners were assessed on their mastery of the subject in a set examination at the end of the course. Increasing emphasis is now being placed on collecting evidence about the learner's achievement of the expected learning outcomes during their training or course of study. There are a number of reasons for this. Without the time constraints of a final examination, a much wider sample of the student's performance can be assessed, increasing the reliability of the examination. In addition, the assessment may be more valid as the assessment tools that can be adopted during the course may assess the learning outcomes that are difficult to assess in an end-of-course final examination. A key additional benefit of in-course assessment is that it provides feedback to the student and teacher and allows time for remediation. Less frequently undertaken is the assessment of the student at the beginning of the training program. A number of years ago, we asked third-year students on day one of their course in endocrinology to complete the end-of-course examination. The results were surprising. Some students scored less than 10%, while other students scored almost 50%, the pass mark for the examination. This highlighted that courses in endocrinology needed to be tailored to suit the different abilities of the students. Independent learning modules were developed which were used successfully to replace lectures on the topic. The first occasion we assess students is when we select students to enter medical studies. This is one of the most important assessment decisions and is discussed in Chapter 34. The progress test. A progress test is an approach to assessment where the student's knowledge is repeatedly assessed at time intervals throughout the course. The features are: questions assess the knowledge expected of the student on graduation. The test is comprehensive, covering all of the domains of relevant medical knowledge. Students from every year in the medical school sit the same examination. The results expected of final year students are very different from those expected of first year students. Students sit the test at fixed intervals and can over time chart their development or progress in different domains. The progress test was introduced in Maastricht and Kansas City and is now widely used. The test can provide useful feedback to students and to curriculum evaluators. In Dundee, for example, following the introduction of a new vertically integrated curriculum, we were able to show that students' knowledge in relation to the basic sciences increased or remained steady instead of declining. Progress tests have been used less commonly to assess clinical competence. Where should the student be assessed? Traditionally, students have been assessed in an examination hall environment, using little papers or by formal clinical examinations in the hospital ward. With moves towards greater authenticity in assessment and with assessment seen more as a continuous process, increased attention is being focused on assessment in the workplace and in the wide range of contexts where teaching takes place. This can be in the hospital or community environment.